Welcome, everyone, to the Bob and Brad podcast. Today, I am with Rick Olderman, physical therapist, and we are going to be doing a live questions and answers again on any pain issues you may be having. Before we get into it, Rick, do you want to give a little information about your background?
Sure. I'm a physical therapist, orthopedic physical therapist. My focus has been on primarily chronic pain for the past 25 years. So that's my kind of specialty. So yeah, and I've written a few books and have some home programs. And my recent book is called Pain Patterns. That gets at the heart of a lot of chronic pain, especially spinal pain and so forth.
And I will quote Bob as Rick is one of Bob's favorite physical therapists around. So this is why Rick does all these live events with me. If they want to find you, they can just go to rickolderman.com, correct?
Yep, sure can. All my books are there and my home programs and stuff like that.
If anyone has any questions that is watching live, feel free to comment and we will get to them. We did have a bunch of questions asked ahead of time, so we will start there. So any type of pain issues you're having, you can't figure out, feel free to ask us. Our first question comes from Stephanie Gee, who says, any suggestions for mid-back vertebrae that like to get stuck and being able to fix at home? I recently went through major surgery followed by a provoked blood clot, which has left me with no options of seeing my chiropractor again until I'm in the clear. Thank you. We can try to show you some mid-back stretches, but our only question kind of with this, Stephanie, whenever you watch this is, what type of surgery did you have and where is the blood clot? Because if it's in the spine, it's going to be way different than if it's like something with your shoulder.
Yeah, exactly. So that's fairly unclear, and a pretty big piece of information we would need is if the surgery is anywhere around where your pain is. Did the pain start after the surgery? Was this pain happening prior to the surgery? Did the surgery change the pain at all? All of those are questions. And then also, what I always find helpful, Mike, is when people put provoking symptoms, like some of these people have said, oh, I have more pain when I'm sitting versus standing or lying down, or, things like that. So Stephanie, it would help us if and everyone else, not just picking on you, Stephanie, it would help us if, when you ask pain questions, whether you tell us, this hurts it, and this seems to make it feel better. That gives us a lot of clues as to what's likely at the source of this. So, thoracic pain could be a lot of things. It could be a shoulder blade problem rather than a spinal problem. And because a lot of muscles from the shoulder blades go into the thoracic spine. Anyway, there's just lots of possibilities. So narrowing that down with provoking symptoms and symptoms that seem to change the pain, and like a little bit more history of whether this began before or after the surgery, where the surgery was, if that affected it at all, would be helpful.
Do you have any suggestions of something she can try if it's
Yeah,
not related to that?
yeah. So because most thoracic pain that I have found has a lot to do with the shoulder blades. And that's because, again, we have these significant muscles that are running from the shoulder blade into the thoracic spine. So most of the things that are happening at the thoracic spine, because let's face it, we have all of these ribs attaching into the thoracic spine, which makes it relatively immobile. So the things that are pulling on all of that, not only are the ribs, but also these muscles that are attaching from the shoulder blade into the thoracic spine. So Stephanie, I think one interesting test that I would do with you if I were seeing you, and you can have someone do with you, is have them stand behind you, and they're going to put their hands in your armpits. And well, let me back up a second. So first of all, if there's a provoking movement that causes your pain, for instance, every time I turn to the right, I get that pain in my thoracic spine, or every time I lift my head, I get that thoracic spine, or lower my head, or whatever that is, a provoking test is really helpful in determining where the problems are. And so let's say you have a test that provokes your pain. Let's say it's just looking up that I feel that in my thoracic spine. So you look up and you determine, how far do I need to look up before that provokes my spine, and how much does that affect my spine? Okay, so now you have that number, and maybe give it a 0 to 10 pain scale so you can identify how painful it is and how far you have to move your head up before you start feeling that. And then you're going to have someone stand behind you, and they're going to lift up your shoulder blades like this. They're going to put your hands in your armpits like this. They're not going to put their fingers up in there and they're like that, because that'll really be painful. You want the hands to look like this, okay? And they're going to lift up your shoulder blades, and your job is to rest the shoulder blades on their hands and relax them completely into their hands, all right? So once you do that, they may need to jiggle the shoulder blades a little bit to get you to relax. So once they do that, then you would go into that provoking test again. For instance, if it was looking up, you would say, and look up again and say, oh, well, I seem to be able to look up further before I feel that pain, or when I do look up, that pain has been reduced from, say, a 7 out of 10 to a 2 out of 10. All right, well, this tells us then that your shoulder blades have a significant role to play in the thoracic pain that you have. And this kind of testing goes for all over the body. Whatever provoking test you have, you do that. And if someone gave you some exercise that is supposed to solve that pain, then you do that exercise for 1 or 2 sets, and then you do that provoking test again and see if it has changed. It should change fairly immediately, your pain. So this is a quick way to work through the things that will help you or hurt you. And so I call it a test-retest strategy, and it's one of the things features in my pain patterns book. But anyway, what we're doing is testing and retesting your pain. And so if your pain was diminished, by holding up the shoulder blades, then we have a really good idea that the shoulder blades are a source of the problems. And then we would then go down that road to see what's going on with the shoulder blades. Well, the test is already showing us what one of the problems is. One of the problems is that your shoulder blades are sitting too low, which is the most common problem with shoulder blades. And simply by lifting them up a little bit, it takes all of that pressure off your thoracic spine. So then we would figure out, okay, well, why are they sitting too low? Let's fix that and do some strengthening around the shoulder blades so that they're sitting appropriately. Fix your posture strategies. Likely that you've got a faulty posture strategy, that you're using your shoulder blades too much, which is causing a lot of this. So that's just one possibility. Sorry to take so long with that one.
Well, I think this relates right into our next question, who comes from Kate Hampshire. So Kate says, I have had shoulder and neck pain on and off for 10 years. I've had physio and doctor says it's probably arthritis and I should learn to live with it. However, it feels more like impingement to me. Then they ask, would a steroid injection help? You're going to want to ask your physician about the steroid injection. Some people find benefits from them, but most of the time it's temporarily. So it's kind of like a Band-Aid, may help for a few months, and then oftentimes it comes back. So I think we have to look at the shoulder blade again. Correct, Rick?
Absolutely, Mike. You're right on the nose. Because it's been around for 10 years, it tells me that this is likely a functional problem, because I understand how most people are approaching it. They're looking at is it a shoulder pain, Mike? I can't remember. Was it
He
neck
said
pain?
Shoulder and neck.
Shoulder. Okay, so they're looking at your neck, your cervical spine, your neck bones, and they're looking at your shoulder and trying to look at 1 or 2 of these, but they're not looking at the whole system together. And so that little test I just went over will help you determine if depressed shoulder blades are the cause of both of these problems. Usually a doctor will say, oh, the shoulder blade pain is coming from the neck because the nerves from the neck feed the shoulder. But often it's the shoulder girdle system that's causing the neck bones to cause compression on those nerves that then feeds again and radiates down the arm. So I would do that test as we just described it. And I bet you, especially if you do a provocative test before, and then you do that test while someone's holding up your shoulder blades, I'll almost bet you that your pain will be significantly reduced.
Do you want to show them any stretches I can try?
Well, I don't want to go down that road, because most people, what they'll do is they'll just jump to the stretches without doing the testing first. And this is the problem, Mike, that I run into with a lot of people who are, which exercise will fix this, that, or the other? Well, we have to test to understand where the problem is first. And so I hate to throw out exercises because there's reasons that the shoulder blades may be sitting too low. one of them may be that your shoulder blade depressors are too tight, but it also could just be your posture strategy, in which case you don't need any stretches at all. So, it could be a mid-trapezius strength problem, in which case a stretch won't solve that. So, but knowing whether your shoulders are depressed or not gives you a big clue as to what to address to fix this problem.
Yeah, and if people don't understand what he means, obvious this is an extreme example I can show, but you can see my one shoulder blade here is really low in comparison to my other one, so this one would be more depressed, and you can kind of see how the musculature in your shoulder as well in your neck is just going to pull a lot, so it's going to cause a lot of issues. So getting it back aligned, which this chair is pretty handy, I can bring it up like that, but
Yes. So a little note about that, Mike, is that you're pointing to your right shoulder, correct?
yeah.
And you're right-handed, correct?
Yep.
So the dominant arm shoulder should always be a little bit more depressed than the non-dominant arm. So that's not necessarily a positive finding for shoulder dysfunction leading to whatever pain. Now, if you look at me, I've got a left shoulder that's depressed, but I'm right-handed. So this is more pathological. And
Sure.
frankly, I just had surgery in this shoulder a few months ago. And also this rib cage is typically depressed too. So there's a lot of things that can center around that have nothing to do with the shoulder at all that are causing that shoulder blade depression. But knowing whether it's the shoulder blade that is the cause of your pain is a huge clue that will help you initially understand where this is coming from. Now, let's say you do that test and there's no change in your pain whatsoever. First of all, I would find that very doubtful based on my clinical experience of working with these types of problems. But then if the way I look at steroids, Mike, and I would be curious to hear what you have to say, is that, if I have narrowed things down, let's say we really find that the problem is the shoulder itself, all right? And there's a pathology in the shoulder that's likely causing the shoulder not to work correctly, which is then stress in the neck because of the shoulder, it's causing the shoulder blade to be dysfunctional. Well, that's when I would then go in, once I've narrowed it down, it's got to be this joint, and we're not able to fix this. So that's when I say, let's try a steroid shot in that joint. It will not only clear up the shoulder, but we'll see if that then also clears up the neck. If it also clears up the neck, then we know that the shoulder is the driver of the problem. And that's the value of steroid shots that I use clinically, is to help me diagnose and confirm a problem. And usually if I can't solve something, it's because there's a structural problem involved. And the steroid shot it won't fix the structural problem, but it will hide it long enough for us to assess whether, if that joint worked perfectly, what effect would that have on the global problem.
Yeah, oftentimes the people I've seen where it's been successful, they're just so inflamed from the dysfunction they're having that the steroid shot helps settle that down, and then they can kind of start doing therapy, stretching, strengthening, different things, and then we kind of get the dysfunction out of their shoulder, so it's kind of a combination of both. But I've also seen other people that get it and literally have no relief at all, and that's normally like, oh, they tore their labrum or they have a really bad rotator cuff tear, like something more severe or
Yeah.
very arthritic or something like that.
Yeah. So I can see the value of doing a steroid shot prior to all of this, but frankly, it's going to mask everything and you won't really get any clear answers. That's why I always try and have it done at the end of our sequence of figuring things out. Now, the other way that I use steroid shots, and I would love to hear your thoughts on this too, Mike, is I think that if the longer that a steroid shot should last several months, if not longer. And so the shorter a steroid shot lasts, the more likely that they have a structural problem interfering and causing the pain. Now, that's assuming the biomechanics are corrected. So if you get a steroid shot and it feels wonderful for a week, but after 2 weeks you start to feel your pain coming back and so forth, well, then there's something significant happening biomechanically or structurally that is continuing to hammer that area. However, if you get a steroid shot, for instance, a lot of people can get a steroid shot once we fix them biomechanically, then they get a steroid shot which puts them over the top, and then they're good for years. In fact, they'll never need one again. And that's because we fixed the biomechanical hammers that are causing the structural stresses to that joint or tissue.
Yeah, I always like to say if you do it and it just feels like a band-aid where it's temporarily beneficial, you still have issues going on. But yeah, if it doesn't come back, then typically they fix whatever issues they're having.
Yeah, sometimes you need a steroid shot to get you over the edge,
Hmm.
like, and like you said, so that you can operate better. But sometimes, it just depends on the type of pain and the complaint. But I usually like to put them later in the sequence of things until I figure out where that cortisone shot should be.
Yeah, my mother actually had one a few years ago. They told her they thought it was frozen shoulder, but her shoulder was still moving fine. So I was kind of
Yeah,
why do you think it's frozen shoulder?
yeah,
And then she ended up getting a steroid shot and it really helped. And she's still active. I mean, she's like 65 now, but
yeah.
it helped her and she's been fine for a couple of years since then. So I'm not saying they can't help, but
They
yeah,
can be
yeah,
miracles. Yeah.
yeah. Just a reminder, anyone watching, if you have any questions, feel free to ask them in the live chat, and we will get to you before we go through all these pre-planned questions we had submitted. The next question is a bit long, but I will try to summarize it best as possible. This comes from Christian. So, in the last 5 years, I get pain in my buttock together with burning nerve pain that goes down my legs when sitting. The pain gets worse when I lean bit backwards when seated. So, I'm guessing they're going more into extension. Sometimes the buttock pain is in my sit bones, and other times it's in the tailbone area. The pain also kicks in when I'm lying flat on my back in bed or on a sofa. They've done a lot of visits, basically checked the gluteal area, even had an MRI, which showed nothing interesting. They say I very rarely have back pain. So it's more just in their glutes. They're saying it down the leg. It's not just in the back. They said they've done exercises like glute bridges, clamshells, and that normally triggers the pain and makes it worse. So any tips would be helpful.
Yeah. Well, what are you thinking, Mike? Right off the bat, when I hear sciatic pain down both legs, I think a disc problem. Is that what you would
Yeah.
think?
And it sounds
Yeah.
like they have an extension problem. They like flexion more.
It's interesting. I was confused by their descriptions because when you sit and you have more pain, that indicates that you have a flexion problem
Yeah, but
because your
then when they
spine is. But they said when they lean back in the chair, it relieves it. But then I'm not clear. How are they leaning? Are they slouching to lean back in the chair? Or are they arching their back to lean back in the chair? That's what I wasn't clear about. So I was, you know, just what you commented on too. I was just like,
they
well,
said
wait a second.
the pain when they're sitting and then they go back, it gets worse. They're saying.
Yes, but are they arching when they go back, or are
Oh,
they
I don't know.
slouching when they're going back?
I'm assuming they're extending because when they lay flat, you're in extension. They said they can't lay flat.
Right. So when they lay flat, then the pain increases. So that is the opposite of what I'm assuming of the symptoms that I'm getting when they're sitting, right?
Yeah, and it's more just in their buttock. I'm
Yeah,
assuming they must extend, but I don't know why flexion hurts if they're seated because normally flexion feels better.
correct. Yeah, so it's this is a mishmash of symptoms and descriptions that are opposite. You know, so what Mike and I are trying to figure out is, do you have more pain when your spine is flexing, or do you have more pain when your spine is extending? And the description is telling us both ways. So what I was wondering, Mike, because I'm just like, well, this is odd that we're getting these kind of symptoms,
Yeah, and imaging doesn't show much
and
either.
imaging isn't showing it. So I'm thinking, well, what if this isn't a spinal issue then? What if it's an SI joint issue? And
Oh,
so
sure.
what I'm thinking is that what I would try, I'm not sure if this person has tried this yet, but on Amazon there are tons of SI joint belts for like $20 or something.
Yeah.
And what I would do is just get an SI joint belt. And what Mike and I are talking about is that this joint here's the sacrum, all right, and then here's the ilium, and where they both meet is this is called the SI joint right there. Well, many of the sciatic nerve roots are coming from the sacrum as well as the lumbar spine. and the MRI is showing a clear lumbar spine. So the next batter up then is likely the sacral area. And SI joint problems can sometimes give symptoms that are confounding, like what Mike and I were talking about earlier. So what the SI joint belt does basically is just squeezes the SI joint to make it more
Compressed.
more compressed or stable. And that way, then that might take the pressure off the nerve roots that are getting tweaked every time this person is moving their pelvis or hips around. So that would be the one first test that I would be kind of curious about, Mike, is to see what the effect, and what I would do as a clinician, so that they wouldn't have to buy a belt first, is I would go up to them and I would just put their hips up against my chest here, and I would squeeze the ilia together. And usually if someone has an SI joint problem, we'll get an immediate response like, oh, that feels so much better. And then I'd say, well, let's get an SI joint belt and see if we can add some compression during your day, whether this calms everything down. Because right now it sounds like it's just getting irritated no matter what this person is doing, right? Sitting, leaning back, laying down, it's always getting irritated, and it's going down both legs. So it leads me to think, well, maybe it's a sacral positioning problem, or maybe it's an SI joint compression issue.
Yeah, some people I know we've had just use a normal belt, as long as your normal belt's big enough, just to try to put around your SI joint. You can just look up a video and where to put it. It's not quite belt line in your pants. It's a little different, but
little low on the belt line.
Yeah. So sometimes we just have them put it really tight and just try that first, and then if you see benefits.
Absolutely. And then, putting pads in there, like if you put a belt on and it's just like, I don't feel any difference. But then if you put like a foam pad in there or something like that, where the belt is, that might make it a little bit more snug and comfortable for you. And so, play around with it. If you don't want to spend the $20 on the SI joint belt on Amazon, and you have a belt that can do this, then get some padding and shove it in there and experiment with that to see if any of that helps at all. And then that points us in the right direction. Oh, this is an SI joint issue. So then what we would do then is figure out, why is the SI joint causing this to happen? And typically, if the SI joint is having problems, it's because there are problems with the muscles feeding into the pelvis and so, like, if the thigh muscles in the front are tight, then they're going to be pulling the pelvis too far, or the ilia too far forward, which is then causing strain to the SI joints. It could be hamstrings, the inner thigh muscles also attached to the pelvis. So it could be all sorts of things, but narrowing it down to the SI joint would be a helpful first step.
Our next question relates to this topic. So this is from Catherine Hood. So they have pain in bony prominence of the buttock when I sit on a hard surface or drive for less than an hour. Less than an hour. Huh. Interesting. Maybe they meant more. Well, they said less.
Yeah. What did you think the bony prominence of the buttocks was, Mike?
I'm assuming they're ischial tuberosities, but
yeah, I wasn't clear on that. So what Mike
when
and
I always say my butt bones, I always think
is it the sit bone, or is it the sacrum that they're having pain on? I wasn't clear about that. So pain in the bony prominence, let's assume it's a sit bone, I'm gonna guess.
Yeah.
All right. Sitting on a hard surface. So, I wonder if the pain is just a point contact pain. So on the sit bone, all of our inner thigh muscles attach into the sit bone, right? And hamstring muscles too. So if I know it's the sit bone, what I would do then is, first of all, see how you're sitting. And then we would play around with your sitting position and the cushioning of your chair. What is it that you're sitting on that's hard? For instance, you mentioned that's driving for less than an hour does this. And I'm assuming it's on both sides of the pelvis. I'm not clear if it's on both sides or one side. So if you sit in a regular chair, like your kitchen chair, for under an hour, does that also cause this? If you sit in your office chair, does that often also cause this? So comparing different types of seating positions will give us clues as to, you know, where this irritation is coming from. And so, for instance, in a car, when we sit down, the knees are fairly high in relation to the hip joint. But in a kitchen chair, the knees are parallel. So that changes the position of the ilium and the pelvis when we're sitting. And so these are just kind of basic questions I'm wondering, is one or both sides, and if there's different chairs that feel differently on this area of pain. And then, you know, do you have really tight or irritated inner thigh muscles? And so, you know, stretching the inner thigh muscles might be a good place to start there to see if that has any effect on this. I'm not sure if someone's done that with you, or massaging them out. And so when I massage inner thigh muscles out, I always stay up close to the pelvic area because the meat of the muscles are up here. And what I would look for is if there's any muscle that seems to refer directly to where your pain is, then we can probably have a good idea that this is an inner thigh muscle tightness or strain issue that's referring to the ischial tuberosity. And frankly, this is very common. Most people mistakenly assume that pain, you know, where it seems like the hamstring is insertion into that ischial tuberosity, means that it's a hamstring strain. But in many of these cases, Mike, I found that they are actually inner thigh strains, not the hamstring, because they insert so closely together on that same bone. People would just assume it's the hamstring.
Yeah, it's kind of hard to feel exactly which one it is. I would say the only thing they could mess around too is like the height of the chair, because you kind of mentioned how car seats are lower. So if you can raise it up or put a cushion underneath you just to be higher, that can try it, or possibly even a little pillow behind your back, because it can change your pelvis angle too. You could just try those things when you're seated and just see if they help. It might not, but.
And then just, you know, as a general idea for all of these questions is Mike and I know absolutely nothing about these people's injury histories or sports histories, you know, and things like that. So previous injuries and surgeries and sports and things like that have a lot to do with probably a lot of these types of problems. So this is one of the things that I found with a lot of people, Mike, and you may have found this clinically too, is that people come in with, say, you know, oh, my right back hurts, or my right, you know, sciatic nerve is always irritated. And, you know, through working with them, we discover that, oh, well, you know, your right ankle doesn't seem to be moving. Oh, well, that was an old ankle sprain 20 years ago, but I'm here for my sciatic pain now. I'm just like, well, I'm sorry, they're both connected. And so, you know, this is what people don't appreciate about the body, is that just because you're not feeling pain from an older injury doesn't mean it's not causing problems in your body. Usually these mysterious aches and pains that people can't seem to solve are usually due to these older problems that have been forgotten and that your body or brain has compensated around. And now it's creating a larger pain problem further up the chain.
I feel attacked right now because I had hip pain and had the tight ankle on the other leg, but
yeah. That was unintentional.
Oh, okay. It's just a good story. Our next question is interesting. Out of the closet asks, why do my favorite pajama leggings suddenly give me intense back pain? There's only like two scenarios I can think in my head. Is either the favorite leggings are getting too tight, but I don't really know why that's going to cause your back pain, or oftentimes you put on pajamas when you're relaxing and lounging versus doing active stuff. So what type of positions are you in when you're wearing them? Are you seated on a couch that's sunk in with really bad posture like this, or are you I'm assuming it's the activities you just happen to be doing or the positions you're in while you're wearing them. I don't necessarily think it's the pants magically causing back pain.
Yeah, and a way to test that, and I think that's very astute, Mike. I wonder the same thing.
Yeah.
So I think the way to test that is don't change in your pajama leggings, but pretend like you did,
Yeah.
and see if you have back pain, still. So it seems improbable, especially leggings. If I'm thinking of them correctly, they're just very light fabric that are
Yeah.
snug
Most of them
but
are
not tight.
stretchy.
Yeah.
They
So
can be compressive, but I think they're normally like stretchy still. They're not
I
like,
wouldn't think those would do anything because they allow full freedom of movement, right?
yeah, unless the
So
waistband's just like taut, but I don't know how that would really cause your back pain per
yeah,
se.
exactly. So both Mike and I are wondering if it's the behavior that you're doing after you change into the leggings
Yeah.
that's causing the back pain. So that would be the big test to figure out first.
All right. That's enough on that question. I don't have much else for that. Tracy,
Interesting.
yeah. Tracy Palmer asks, why are my hips so stiff when I get up from seated and ache in bed at night? I get minimal relief from stretching and exercises, and walking seems to aggravate it.
What are your thoughts on that one, Mike?
Hips are stiff when they sit and ache. Well, I'm assuming when they get stuck in one position for a really long time, they hurt more. But then it also sounds like doing any movement hurts as well. It's kind of hard to say. They said hips plural, so it sounds like both,
Yeah.
not just
Yeah.
singular. I don't know. Yeah, the problem is I don't know their mobility is like in their hips, or if they're arthritic or not, or it could be a lot of different things.
Yeah. So one of the things I'm wondering about is this thing called an anterior femoral glide syndrome. And what that means is that, and this is a very common problem with a lot of people, is that the thigh bone is migrating forward in the hip socket. And this especially happens when we sit. And so the hips are in an incorrect position in the hip socket when sitting, which then impinges the labrum or groin muscles and things like that. And so usually the reason this is happening is because of poor gluteal activity. The butt muscles start here at the sacrum and they attach to the hip bone up here, and one of their jobs, they have many jobs, one of their jobs is to create a pivot point for the thigh bone to work correctly in the hip socket. Well, the way that most people sit and walk turns off the gluteal muscles. So then this creates what's called this anterior femoral glide syndrome, anterior meaning forward, and it's gliding. And so this starts to move in the wrong place. I can't tell you how many times this is the source of so much hip and pelvic and back pain is this condition. And you can imagine that if the hip bone is sitting incorrectly in the hip joint, then we have this IT band that's running down the side, and deep to that IT band is a bursa sac. Well, if the thigh bone isn't sitting correctly underneath that bursa sac, it's going to cause a bursitis issue. It'll cause groin pain. It can cause labral tears in the hip, and it can cause piriformis syndrome pain because the butt isn't working. Then the piriformis muscle, which mimics the butt muscle, but is like a pinky versus a whole hand, is left straining to control this hip bone. So this is one of the wonders I have. And so when they say that they get minimal relief from stretching and exercise, well, I don't know what kind of exercise they're trying to do or stretches they're trying to do, but the one exercise that I recommend to solve the anterior femoral glide syndrome is getting in that donkey position and then doing some butt pumps like this and isolating the butt muscle, and that will start to pull the femur head back in the socket again. So again, what would be helpful for this is, how long can you sit before you get up with the stiffness? So let's say it's 1 minute. Okay, when I sit for a minute or longer, I get really stiff in the hips. All right, so there's your test. And then we do 2 sets of butt pumps. And then we sit down for a minute again and we stand back up. Is it better, worse, or the same? If it's better, then, oh, okay, well, we might have figured out what the problem is that your butt isn't actively controlling the hip joint correctly, and it's sitting in an improper position and causing this pain. So that would be the first place I look, because this is such a common yet underdiagnosed or misdiagnosed problem. Most practitioners haven't even heard of an anterior femoral glide syndrome before.
Yeah, Brad often struggles to say it. I always have to say that term.
Yeah. Yeah. So anyway, hopefully that's helpful, Tracy, Palmer, Wilson. And again, for all of you people sending in questions, doing a test where you provoke the symptoms, and usually a quicker test is better. For instance, Tracy, if you had to sit down for 30 minutes before your hips get stiff, then this kind of retest strategy won't help, because a lot happens in that 30 minutes. It's preferable if the test is a quick, like, oh, if I'm sitting and I lift my knee up, that's when I feel that same pain kind of thing. You know, we need a quicker test that's reproducible.
Just a reminder, anyone watching has any questions, feel free to put it in the chat. We will get them and answer them the best we can. Our next one from submitted earlier is a little bit long, comes from Mr. Jolly. So they have a psoriatic arthritis patient in their mid-40s. I had to look up what this was. Apparently, it's a form of arthritis you get when you have psoriasis. I did not know it was a thing, but I'm learning stuff, I guess. Anyway, they struggle mostly with back pain for more than 6 months. They're very active. They work in the car repair industry, but lately they've really had a hard time working with lower back pain, and they get some knee pain as well. Even standing or walking more than an hour, let alone lifting heavy objects, also hurts his fingers and swelling as well. So it sounds like they have a whole array of issues. They're primarily, as they digress in the comment here, they're basically saying they have a lot of back pain, often hear cracking and popping from the spine while moving. They're currently taking a bunch of anti-inflammatory medications, but basically he's saying, I am out of ideas of what to do. The only time he does not have pain is when he's lying down in his bed or sitting down. Other than that, nothing is helping.
Yeah, so I agree with you, Mike. It sounds like there are several issues feeding the back pain, probably, right?
Yeah.
He's got some knee issues,
Sounds
possibly
like
some overall inflammation issues,
Yeah.
right? That could be a dietary source of inflammation. And then, you know, I don't know whether this person is overweight or not, and maybe their weight is causing excessive, especially, you know, I think car repair industry, wow, that's a lot of heavy lifting and awkward postures. You
Yeah.
know, you've got to be in pretty good shape when you do something like that. And so I'm not sure, you know, what kind of condition this person is in, if weight is an issue. What I also think, Mike, also is interesting is that he says it's been more than 6 months now. And so I wonder if there was a precipitating event that caused this back pain to begin. That precipitating event usually points us in the direction of where we need to go to solve this. So that would be one of the questions on my plate for this guy. I think the other clue, and you hit it at the very end, is that his pain stops when he sits down. And this goes back to what Mike and you and I were talking about at the beginning, is an extension problem, right? So an extension problem simply means that the back is too arched, the lower back is too arched, or there are too many forces trying to pull it into an arch. And so with these types of people, the test is if they lie down with their legs straight, and then after 30 seconds, they bend their knees. Bending the knees when lying down should feel a lot better for someone with an extension problem. Well, the same thing is happening. This person sounds like they're saying, when I'm standing tall, I have more pain, but when I sit down, I have less pain. Well, you're having less pain because your spine is flexing. And so this sounds like they have an extension problem. When they say they lie down on their back, it makes me wonder if they're putting a pillow or something underneath their knees, which would also help with that situation too. Or if they're a very heavy person, then simply unloading the joints by sitting or lying down would also take away this pain, right?
Yeah, I mean, I'm just imagining someone that's constantly, well, they feel better when they're flexed, though. I was gonna say, I feel like they're probably flexed over a lot. I guess if you're laying under a car, I guess people work standing up now.
Yeah.
Under cars, depending upon the lifts. But yeah, it sounds to me like they have an extension problem, so they often have tight muscles. I mean, they could have herniated discs as well, but he doesn't really specify like one-sided or two-sided back pain
Yeah.
at all
I would
either.
go back to that 6 months. What happened? Was there a change in your working situation, or your exercise, or your home life, or your exercise or your recreation activities, maybe 9 months ago, that then caught up with you 3 months later? And so, let's look for clues. And then also, Mike, you and I mentioned earlier, your previous history of issues has a lot to do with current pain. So if this person has old knee issues or old ankle or foot issues, then this likely has its roots in those older issues. And now you're not using your legs as well. And so now you're using your back more to compensate for poor lower body usage. And then I wanted to also comment on your idea, Mike, about bending. Yeah. So someone with an extension problem, when they bend, they tend to like to keep their back arched like this, right? And that's appropriate for really heavy lifting, but for heavy lifting, it should be more like this. But what I have found is that people with extension problems, which we're assuming that this guy is, maybe he's even doing light lifting with his back arched like this. And so changing your strategy for bending. So when you are not lifting heavy things or not staying in prolonged positions, bending over, then a better lifting strategy is to put one of your legs forward and bend that knee and relax the back into that lift, and then come up into more arching if you want to at the top. But allow the back to come out of that arched position. When you just lock the back into this arched position all the time, then you're basically causing your muscles to be contracted in the pattern that's causing it to have pain at all times. So another thing that would cause this is like pregnant women have this problem when the fetus gets large, it pulls the belly forward and pulls their spine into this arch. Likewise, if you're a heavy person and have a large belly, that's also going to pull the pelvis forward and into this arch. So if that's happening with you, if you have a large belly, what I would then say is, there are belts on Amazon that you can get that hold the belly and pull it in for you and take that load off of your back for you. So, if exercising and stretching and other things aren't working out, it's just simply removing the load and changing slightly your lifting mechanics can do wonders for these people.
So we just had a question from a current viewer right now. I'll just pop it on screen and kind of read it. So this is from, I'm sorry, I'm going to butcher your name, Ibrar Ali. So, hi, had sciatica since November, pain from hip down to the calf, a little pain in the back, been having physio since then and see no improvements. I only get pain from standing and walking.
Yes. So right off the bat, Ibrar, especially when you have unilateral pain, so it's due to something called a side bending problem. And a side bending problem is when one side of the pelvis is higher and the other side rib cage, and this usually the same side rib cage, is lower. And you can see that would create compression on this side of the spine, the nerve roots, etc. So first of all, if this has been going on, I'm not sure how long this has been going on. Does it say, Mike?
Since November.
Okay, so one way you can see whether you have a side bending problem is simply taking off your shirt, have someone take a picture of your back, and what you'll see is a crease on a larger crease on one side of your waist than the other. If that crease is occurring on the same side of your sciatic pain, likely you have a side bending problem. Now, if this is a relatively recent change in your body, which is unlikely because sciatic pain, these kinds of things usually take months or years to wind through your body. But if this is a relatively recent condition, then you may not have the crease, and you'll have to look more closely to see whether one side of your pelvis looks higher than the other. You won't be able to see whether your rib cage is lower on that side. this is because you're still going to physio, you can go in there and ask them to measure the heights of your pelvis and rib cage and see if you have this pattern. Likely, because most clinicians aren't aware of this pattern of problems. They don't think to measure for it. And so measuring, what you're looking for is likely the pelvis is going to be higher on the side of your sciatic pain. And likely if they measure the bottommost rib, they'll find that that is lower than the other rib as well, causing this side bending problem. Now, the easy way to fix this, and Ibar, you're already, looks like you're giving us a clue here, is that it hurts most when you're walking and standing, which means that you're likely walking and standing asymmetrically. And so something that you're doing is causing you to perhaps collapse on that side of your sciatic nerve. Or if you look at yourself, objectively in a mirror or take a video of yourself, I wonder if you have a type of shift over to the side where you're having sciatic pain. So these would be clues as to what is causing the compression of the sciatic nerve. So Mike and I mentioned earlier that it can be an old injury from your foot and ankle. It could be an old injury from your knee. It could be an old injury from your hip. It could be an old injury in the same leg, or it could be an old injury in the opposite leg. But for some reason, and if any of this is like, you're just like, oh, you know what? I do remember when I sprained my ankle really bad on this, backpacking trip, 5 years ago or something like that. Ding, ding. That's probably where it is, where the source of the problem is. So anyway, determining the pattern first to see whether you have a side bending problem. And I would almost bet money that you do, because unilateral pain almost always has a side bending pattern as the pattern that's causing the pain. Once you determine that you have that pattern, then you determine what is causing you to have that pattern. Now, I would be really curious, Ibrar, if you were walking, let's say, you walk 10 steps and oh man, there's my sciatic pain. There's my sciatic pain. So here's a little thing you can try. Just simply put your arm, let's say it's my left side. I would put my left arm up in the air and I'd walk that same 10 steps. And when I step on my left leg, I would reach my arm up higher for every step on that and see if that makes your pain go away. If it does, then what we're doing is fixing your gait pattern, which is where the roots of this problem are.
He chimed in and says, I have no ACL since 15 years.
Oh, on the same side?
Is it the same side? You can let us know. He didn't mention. I don't know if he means 15 years ago or 15 years old when he was. I don't know his age.
Yeah.
But yeah, I'm assuming if you have no ACL and didn't get it repaired, you're probably compensating.
Yeah. So here's another quick way to figure that out. Let me just move this. All right, Ibrar. So you don't have an ACL. All right. So for folks, what an ACL is, it's a ligament in the knee that creates stability within the knee joint. And so whichever knee, I'm not sure which one.
He just said yes, and we asked same side, so I'm guessing he means same side.
Okay, so same side, so it's likely he's compensating. So Ibrar, here's how you can determine which leg this is coming from. You find a chair, right? And you pick a chair height that you think that you can successfully stand up in with just using one leg. So you would sit down and all you would do is stand up and then sit down with one leg and then check the other leg. And what you'll likely notice is the side of where that ACL tear is likely much weaker than the side where you have an ACL, which means that your sciatic pain is being caused by the weakness and instability of your left leg. So what you would need to do, and it doesn't, you could have other issues too. You may have an ankle issue or hip issue or whatever. But anyway, if that's the case, then what's happening is your body is compensating to get off of that weakness in your ACL by lifting the pelvis up. So you will need to strengthen that side of your body. And I bet you the stronger that you get with being able to stand up and fix your gait pattern so that you're not doing something asymmetrical like this, right? I bet you that sciatic pain will go away for you relatively quickly.
Yeah, he did confirm it's on the same side now.
Yeah.
So.
So he's got a same side issue and he needs to strengthen that leg and walk on it correctly. The reaching exercise that I mentioned will teach your body how to walk on that leg correctly.
Sure. Any other tips? Otherwise, I'll go to the next question.
Yeah, let's go on to the next question. That's a good start for him.
He said thank you. Our last question we had submitted ahead of time. If anyone watching has questions about any type of pain issues, feel free to submit them in the comments and we will get to them. Our last one submitted ahead of time is from, I don't know how to pronounce his name, Mukund Kohan, something like that. So I have a lot of tight muscles in my lower back, mainly piriformis, quadratus lumborum, SIJ, so I'm guessing they mean SI joint region, and glute medius. I also have tight quads, hamstrings, and well, they have tight everything. What's the best way of making these muscles loose and strong?
Yeah, well, first of all, we need to know whether there's something pathological causing this tightness, right? So have you always been tight like this? Is this something relatively new? If it's something new, is it a result of you changing your exercise routine or your work routine, or is there an emotional or psychological event that occurred after which your body started becoming more tight and then causing the back pain? But it's tempting to blame the back pain on all of the tight muscles.
They didn't really say they had pain. They just said they had tight muscles.
Oh, okay.
Yeah.
All right.
Well, for
okay.
stretches. I'm presuming that in my head, but they didn't say this. I'm presuming they sit more often because often we get, more tight if we sit more and do less. But I honestly don't know.
Yeah. So, well, then that becomes a kind of subjective complaint that my muscles are tight, but are they tighter than everyone else's? Are they normally tight? Is it that you want to be loose like a yogi master and be able to wrap both feet behind your head? And so you're not able to do that. So this is kind of a subjective question. We don't know if your tight muscles are too tight or just about normal for someone your age or occupation or activity level. So that's a difficult one to answer. So
because a lot of these muscle groups need different stretches in the opposite directions.
I would say in general, I mean, I'm sure you've probably already tried this, but yoga is a good general comprehensive stretching approach. Pilates is a good general comprehensive stretching approach to solving all of these tight muscles. So
there's plenty of free follow along videos on the internet too, and not just from Bob and Brad. There's a lot. I do yoga online sometimes. It's just kind of convenient for me, but just finding a routine and sticking to it as long as it's not causing pain is fine. If you're just looking for something to stick to, I guess we don't really have a specific routine for you because we can't visually see you and there's not enough description here.
I think the key, and you can maybe chime in on this, Mike. I think the key is to be consistent, and you may not want to feel like you should stretch for a half hour a day, 7 days a week, but that may be necessary to start, creating change that you want to see. And then once you get to the point where you're kind of happy, then you can start dialing back on the frequency or time that you spend stretching and see what your body will hold on to based on that. So, maybe that would be an approach too.
Yeah, I know personally, I am way more prone to doing a 10-minute stretching routine numerous days a week than doing a 30 or 1 hour one, because I will make the time if I really want to do it, but I'm less likely to do it. I'll skip it. Where it's like, okay, this takes 10 minutes. I have 10 minutes like most people do.
Yeah, agreed.
All right. Well, I have no other questions submitted. If anyone still watching wants to submit one, feel free to. We'll stay on for about 5 more minutes. Rick, do you want to mention again where people can find you at and your programs and your, what do you call it? You have classes too, don't you? I forget what the term you use. Group sessions?
Oh, well, those I have. Okay, so in my home programs, kind of walk people through most of the exercises that will solve almost all pain from head to toe. There's different programs for different parts of the body. But within those programs, I have group coaching calls. And so you can sign up to have group coaching calls in there for an hour every week at the same time, and with other people who are experiencing pain. And I answer questions. I run tests. I try and figure out what, why you're hurting, what's going on, and guide you through the process of solving your pain. It's a cheaper way of getting time with me, and having you purchase the home program first. Make sure that we're all on the same page first, and everyone on the call is on the same page, because they are all purchasers of the programs. And so, I don't have to start from zero and explain this is an extension problem, this is a flexion problem. All of that testing's in there.
And then if people really want some one-on-one attention from you, you meet with them virtually?
Yeah, I do one-on-one sessions too. You can sign up for all of that stuff. Just go to my website, rickolderman.com, and you can find my books, my home programs. If you want to have an appointment with me, sign up for there, all that stuff. And then I also have, not to compete with you, Mike, but I also have my own YouTube channel. So you can go on YouTube. I post a lot of helpful videos on there for helping people, understand their pain and solve it. So
yeah, the more influencers, the better. I mean, we got to help people out from all different aspects.
Yeah, I'm just trying to, emulate you guys.
Well, those two have been at it forever. I just kind of hopped on recently, but
yeah.
All right. Well, it looks like we have no more questions. Thank you, Rick, for joining me again. We will be back sometime next month answering pain questions again. So make sure to pay attention when we post, ask for questions ahead of time, or you can always ask live. Do you have any last remarks you'd like to make, Rick?
Oh, yeah, I forgot. I recently wrote this book called Pain Patterns. It's available on Amazon, and there's also an Amazon link on my website if you go to my website. But I think this is my best book, and it talks about how I developed this whole, how I see the body, which is different than most practitioners. And that's the first half of the book. The second half of the book is a workbook that takes you through about 8 different tests to determine why you're having chronic pain. And so I really think it's my best book and the most comprehensive. It kind of gives you a whole blueprint about how you should be thinking about your pain, where the problems are that you haven't been able to find or your practitioners haven't been able to find, and then exercises on how to correct those. So I really love this book. And if you want to kind of get introduced to my information, I think that would be the best way to do it, non-committally. Just get the book, read it, and I think it will definitely point you in a brand new direction that you've never thought of before.
A viewer named Vera says Rick's program and videos are excellent, and they also said your book is excellent. So there you go. You got a fan.
Thanks, Vera.
All right. Well, let's wrap it up.
Vera is actually in my coaching calls.
On
Thursday nights. So
sure.
So, yeah. So we're working
she knows.
Together.
Does Rick behave as well on those as he does on this, or does he get a little wild? That's what.
Okay, I think we need to stop this right
now. Thank you everyone for joining us on this live, and thank you, Rick.
All right, thank you, Mike. Talk to you later.